So today we are going to do a demonstration using holoanatomy. So using this holoanatomy we will see how we can explore the heart from superficial aspect of the thoracic wall and go inner towards the heart. So we will have an idea that in how much depth in the thoracic cavity the heart is located. So you can see a model of skeleton there, and now I am going to add the muscles and heart and the arteries. So you can see gradually the muscles are added in layer by layer. So at this level you can see the intercostal muscles are added. So maybe from internal intercostal, external intercostal, and as I go now the pectoralis minor is being added, pectoralis major is also being added, and now I want to add the arterial system. So heart will be added with some of the arteries. Okay, now what I am going to do is that you can see the left pectoralis major, right pectoralis major. So in this what you can see in this image, we cannot see anterior part of the thoracic wall, that is skin, superficial fascia, pectoral fascia, that we cannot see. Clavipectoral fascia also we cannot see. So you can see that pectoralis major is having the clavicular fiber and sternal fiber, although I cannot show very clearly and all the parts, but you can see how it is taking origin from the sternum and the anterior end of the ribs, and also some aspect coming from external oblique aponeurosis, and it is going to be inserted into the humerus. So now I remove the right pectoralis major, I go to left pectoralis major and remove the left pectoralis major also. Now what you see internal to the pectoralis major is pectoralis minor. So this is a left pectoralis minor. To my view it is left pectoralis minor. So sorry, I removed also the left biceps because I cannot pinch exactly that muscle. So now I am going to right pectoralis minor. I remove right pectoralis minor. So now under my view is all the intercostal muscles. We all know that external intercostal is going downward, forward and medially, and internal intercostal is inside external intercostal in the intercostal space, and their orientation is 90 degree to external intercostal. So now I am going to right external intercostal and remove the right external intercostal muscles. So similarly now I go to the left side and find out the left external intercostal muscle, and I remove the left external intercostal muscles. So now maybe I can see the sternum here, body, xiphoid process, manubrium. So I remove the manubrium. I remove the manubrium. We can see the aorta inside, ascending aorta and arch of the aorta view. We can remove the body and xiphoid process, but let us now go to internal intercostal first. So this is internal intercostal. So we can remove left side internal intercostal. This is right side some ribs are removed, so right side internal intercostal now is innermost intercostal. So this is innermost intercostal. We can use innermost intercostal along with the ribs, and now we can see the view of the thoracic cavity inside. We can also remove some costal cartilages and the ribs also for better view. We can see transversus thoracis muscle here. So this is right transversus thoracis. We can see the right transversus thoracis with some of the costal cartilages which have been removed. So this is the body of the xiphoid process with the remaining part of the transversus thoracis muscle. Other part of the ribs have been removed. This is innermost intercostal of the left side which have been removed. Let us now remove the ribs. You can see also the serratus anterior muscle here, serratus anterior muscle here. The sternocleidomastoid is seen here, sternocleidomastoid muscle. Transversus thoracis of the left side, transversus thoracis of the right side, and now we can see the heart view clearly. You can see the right atrium, you can see the in between right atrium and right ventricle, the right coronary artery. Here is right ventricle, left ventricle, the anterior, left anterior descending artery is also seen. We can see the superior vena cava. We can see the arch of the aorta. This is the ascending aorta and arch of the aorta. So let us remove the anterior part of the right ventricle. This green color structure is actually the left internal thoracic artery is also removed. So what we can see now is internal structure of the heart on the right side. You can see tricuspid valve, ring, cusp. You can see now cusp also, the three cusp in the tricuspid valve, the chordae tendineae, the papillary muscle, two papillary muscle, although papillary muscle somewhat shown as here not so much reddish as whitish color. You can see trabeculae carni on the right ventricle, and you can see the pulmonary valve also, the pulmonary valve at the entry point of the pulmonary trunk. So let us try to look at interventricular septum, and you can remove the interventricular septum or not. In that case, we can see the view of the right and left part of the ventricle well. So you can see I have removed the interventricular septum, and in this aspect right and left part of the ventricle is somewhat clearly seen. So this is the left ventricular wall. We can see the thickness of the left ventricular wall also. So we can see now on the right hand side the structures of the tricuspid valve, and on the left hand side, if we peep, we can see clearly how it is different from bicuspid valve. The two cusp of the bicuspid valve, mitral valve, chordae tendineae, and the papillary muscle in this here is clearly seen. We can also see trabeculae carni. So one thing is there, that the interventricular septum I have removed, so I can try to go and also sometimes we can go back and add or remove. So if we go to here and reset, so you see that some of the structures are coming back. Some of the structures are coming back. If I want to want all the structures to come back together, I should use multiple selection and reset all. So you can see it come back to original position where you started with the anterior thoracic wall with all the muscles. So we end the demonstration here. Thank you.